or are sending me those so I can okay them. Okay. Let's see here. Okay, are you guys able to see that now in PowerPoint? I'll flip it to slideshow view, so hopefully that doesn't throw your guys' camera off. Can you see that?
Yes, we
Okay.
can.
Okay, perfect. Thank you. Okay. So pediatric nursing week 3. Okay, so we're going to start with school age kiddos for this week. So growth and development, school age is usually 6 to 12 years of age. Okay. So usually from when they're starting to first lose their deciduous teeth, so they're losing their baby teeth, and then it ends at puberty, where they're usually getting their final permanent adult teeth. Okay. Less drastic growth and development. It's more of a gradual pattern than it was prior to school age. And then there's progress with physical maturity and emotional maturity in this age period. So during middle childhood, your height should increase by about 2 inches a year. Usually from 6 to 12 years of age, 1 to 2 feet of growth are gained. Weight almost doubles. Boys are usually about the same size as girls through middle childhood or through school age until they hit puberty during adolescence. Okay. So their movements are more developed than those of preschoolers or toddlers. So they're more graceful, they're more coordinated with their sports and things like that. Increasing muscle tissue and muscular development, skeletal lengthening, and then they're not, their fat is diminishing. Okay. So they don't have those kind of bigger tummies like the toddlers do. They're kind of looking all more proportionate. Okay. There's changes in their facial proportions, and most kids lose their first tooth around age 6. Their bladder capacity increases. Their heart is smaller in relation to the rest of their body up until school age time period. The heart is pretty large in their chest cavity compared to the rest of their body. Their immune system is increasing in its effectiveness because of the exposure to all the germs in the school setting. Their bones are continuing to harden or ossify. And then physical maturity is not necessarily coordinated or correlated with emotional and social maturity. So even though the kiddo might look physically older, mature, it does not necessarily mean that they're emotionally and socially mature. Okay. If kids start to have behavioral changes, okay, especially with physical symptoms, then they're pointing you towards some sort of sign of distress. Okay, so if they start refusing to go to school, and they're having more hard time staying on task, things like that, there's something going on in that kiddo's life. Prepubescence, so that's a period from 2 years of age to 13 years of age, typically. Okay, so usually is pre-adolescence or the kind of the school age time period, and then prepubescence varies from age 9 to 12 in girls. Okay, and then boys, it's closer to 11 to 14. Okay, for when puberty begins. Okay. Girls are usually about 2 years earlier than boys for puberty. Okay, so average age in girls is 10 and average age in boys is 12. Okay, so your assessment for the school age kiddo. You are more likely to be able to do kind of a normal, typical adult exam stepwise approach in this age group. Okay. to where before in preschool, toddler, infants, you had to kind of do the least invasive things first to be able to do your exam effectively in the most accurate way. Okay. And then obviously looking at that child's developmental level and how you're going to assess them. Okay, psychosocial development. So latency period for Freud. So this is, Freud believes that school-age kids are kind of obsessed with the same-sex parent and the same-sex peer until they go through puberty, okay? So this is kind of, they're more identified with same-sex peers, so they want to be around, their girlfriends or boys who are friends, and be included in same-sex peer relationships, okay? So for Erikson, psychosocial developmental theorist, this is the stage of accomplishment. This is industry versus inferiority. So they're working on mastering tasks. And if they're unable to get a sense of independence and master that task, then you will see these kids feel inferior, okay, or have low self-esteem, okay? Peer approval is a big motivator. However, these kids are still really caring about their parents' opinions. Okay. Sense of inferiority is what occurs if they are not able to become industrious. Okay. So like I said, they might be hard on themselves. They might feel inferior. It definitely may affect their feelings towards their social environment or kind of their self-esteem. Okay, cognitive developmental theorist, that is Piaget. We're in concrete operations in school age group. Okay, so this is, they're mastering that concept of conservation. Remember that concept of conservation is you have two different types of cups. One's a tall, skinny glass, and one's a short, more round glass, but they hold the same amount of fluid. So these kids in concrete operations understand that that's still the same amount of fluid, even though the cups look like two different types of cups. Okay. They're understanding more cause and effect, but still very concrete. Okay. And this kind of talks about the conservation concepts. So I'll let you guys look at that page. So concrete operational stage. So the third stage of concrete operation is from ages 4 to 7. Like I said, they're understanding that conservation piece. And then socio-centricity. So when you're not feeling well, you're resting on the couch with your eyes closed. That child should then bring you your favorite blanket to try to make you feel better. Okay. So they're kind of learning how to read and interact with their social environment as well. Formal operations, this is the fourth stage of Piaget's concrete operational or of formal operations. So this happens typically from age 11 to 12. Okay. And these kids are systematically solving a problem in a methodical way. Okay. So they're able to think of multiple solutions, multiple possible outcomes, and then hypothetical things too. Okay. Moral development, this is Kohlberg is your moral developmental theorist. Ages 6 to 7, you're looking at rewards and punishments to guide choices. Older kids are able to kind of judge, an act or something that they're going to be doing by the intentions that started that act. Okay. Rules and judgments become more based on needs and desires of others. And then between ages 7 and 12, the child is starting to conform to the rules to make others happy. Okay, rule followers. Spiritual development, my goodness. So kids in the school age population are pretty concrete in their term of spiritual development, but kids can definitely be avid learners and wanting to know and learn about their potential God based on whatever their family believes. Okay. Kids may feel that their injury or their illness is because of something that they did in their real life. They did something, they told a lie, and then they were diagnosed with cancer. So they feel like that lie that they told was the reason, was their punishment, or their punishment for that lie is, the diagnosis of cancer. Okay. And they start to identify, if they do something bad, they're going to be punished. Social development, peer group is more important in the school age group, but still parents are their major influence. Okay. Sex roles are strongly influenced by their peer relationships. So they're going to mostly have friend groups of the same sex in school age group development. Okay. They're starting to be involved in more clubs and peer groups. They're starting to do more competitive sports, dance, things like that. So there's some more kind of cliques or kind of groups that kids may feel left out of, which then is leading to more chance of bullying. Okay. Like I said, parents are still the primary influence in shaping that child's growth and development in this age group. However, peers are starting to kind of have some influence as well. Okay. And remember, parents, if you're a parent, you need to be the adult, not the friend. Okay. So talking with parents about that is really important too. Play, they're learning rules, they're getting more ritualistic, they're starting to do competitive team play. They might be doing quiet games and activities such as reading or playing piano. They're starting to master their ego. So they're becoming really industrious and trying to kind of fit in where they feel like they belong. And their peer group may influence that type of activities and things that they're doing. Okay. So they're starting to realize their own ability. They're kind of more cognitively aware of their own abilities, their values. They're starting to put more value on their appearance to others. Adults can really help shape that child and drive their success. And then also allowing these kids to start by doing things themselves. It allows them to start developing feelings of self-respect, self-confidence, and more happiness. Okay. So developing body image. So kids in school age groups are starting to kind of starting to identify the differences in their body types and how that might influence their feeling of feeling inferior to others. Okay. The head is typically the most important of the body in school age kids. So they might talk more about their hair color or their eye color. But, of course, as they get into adolescence, body image, overall body image is a lot more of the important focus. Okay. So school experience, this is a huge step in normal growth and development. If they, have a really rough teacher their first year of kindergarten, or a difficult teacher that maybe has a hard time managing their personality, this can really make or break a child's school environment and school experience. Okay. School is the only other place most kids in school age range are getting socialization separate from their families. So that's really important that they're socializing at school. Okay. And like I've said multiple times, peer relationships are increasing in importance. Nutrition continues to be a huge focus in order to promote their growth. So making sure that they're eating a balanced diet. Fast food concerns. So fast food obviously isn't the most healthy thing for any of us. It seems that during the school age years with all the activities that are going on, there's more fast food use. So talking with kids about that. Making sure that they're not eating fast food every single night and getting a good variety on their plate. The website My Plate is really helpful to talk about how much of each food group type they should have on their plate. Okay. They're going to follow their pattern that their family does with eating. Okay. So if their family, maybe has more of a unhealthy pattern of eating, you might have to talk with parents and the family as a whole about kind of the quality of diet that they're eating and how to change that. Okay. Increasing health concerns related to childhood obesity. This is becoming an epidemic. So it's definitely worsening overall, not only in the US, but across the board. Of course, with more technology like phones and screens and video games, kids are being less physically active. So this is driving kind of the obesity in children. So making sure you're talking with the kids about how to have good physical activity. The other piece is in low income environments due to potential lack of just access to places to be physically active that are safe for these kids. That kind of also drives the increased obesity risk. Okay. Kids who are overweight or obese have increased risk of hypertension, diabetes, cholesterol all being high. Okay. So all of the things that you can see with adult related obesity, you can also see in children. So trying to talk with kids about the potential effects of their food choices and their lack of activity early on is really helpful in trying to prevent obesity in the future. Does somebody have a question? No? Okay. Do you have a question? Sorry. Getting an echo back here. Okay. Okay. So preventative strategies, you should start talking about prevention of obesity as early as you can, even in the prenatal period. Okay. So even prior to mom becoming pregnant, it's really important to talk about healthy eating and preventative strategies to combat obesity. Okay. Lifestyle interventions. So, increasing fruits and veggie intake, eating at the table as a family, not in front of a TV, all of those sort of things can be kind of helpful interventions to combat childhood obesity. Making sure that you're teaching every kiddo these techniques that is more helpful to these kids. Okay. School age kids should not be forced to finish their plate of food if they're hungry. Okay. If parents are forcing these kids to finish their food and their plate when they're not hungry, then that is where you can see obesity become more of a risk. Okay. Sleep and rest, so 7 to 11 hours on average of night. during the school age period is kind of typical time frame, but some kids might need more like 12 to 13 hours. It just depends on the kiddo, okay? Starting around age of 8 to 11, you can start to see some more resistance with going to bed during the time frame that they should be going to bed to achieve those 9 to 11 hours. And then around age 12, they tend to be less resistant to bedtimes. Okay. Increasing sports activity. So competitive sports, sometimes early participation in competitive sports can lead to lower self-esteem just because of the demands that competitive sports place these kids in. So making sure that these kids are physically and emotionally matured to be in that competitive sport environment. Okay, and that kind of varies based on the kiddo. As they're acquiring their skills, generally, most kids then like to be competitive. Okay. And then use of cell phones, the significant amount of time on social media, and social media influences then attitudes. So a lot of times if they're having a lot of screen time, then they're having a lot less involvement in sports and in-person exercise, kind of typical childhood activities. So making sure you're talking with parents and the child about not doing too much screen time and increasing their activity. Dental health. So what starts to happen over the school age time period is we start losing our baby teeth and start getting our permanent teeth. So really good dental hygiene is super important. Making sure kids are brushing twice a day, but for sure before going to bed at night, because they need to brush all of the sugar and gunk that they ate all day off of their teeth before bed. Flossing, usually that doesn't come until about 5 to 7 for kids to be able to floss their teeth themselves. Okay. Losing a tooth too early is kind of a sign of poor dental care. So, making sure that these kids are getting into a good dentist that can keep an eye on their dental hygiene. Trying to prevent dental caries, so not having those bottles or juice in the bed or in the crib when their baby's going to sleep with bottles, making sure that they are not doing that. That hopefully helps prevent dental cavities or caries. Obviously, brushing teeth routinely and flossing also helps with that. Okay. Malocclusion, that's when the upper and lower dental arches do not approximate in the proper relationships. So, you kind of have an overbite or an underbite. Okay. Dental injury, of course, that's any sort of injury to the dentation, and then a dental avulsion is where they have to reattach. If a tooth comes out, and it's an adult tooth, what is the thing that you should put that tooth in?
Milk.
Milk. Yep, cold milk. The other thing that your book talks about is if for some reason you don't have cold milk. Do you guys remember? It actually talks about you can put that tooth under the kiddo's tongue, which depending on the age, that might be a kind of a risk. Or you can put it under your own tongue. Now I'm gonna elect for the milk option personally myself, but if you don't have cold milk rounds, that would be another potential option to save that tooth. Sexual education is an important part of middle childhood. Okay, this is the ideal time for formal sexual education because it's prior to the adolescent period. So giving them information that is black and white, written and oral information is most beneficial to kids. Okay, so they're not going to other sources to talk about sex education. Okay. Keeping those parents in the loop too while you're providing the sexual education. Okay. So answer questions honestly. Okay. Allow these kids to ask questions, differentiate between sex, so biological sex and sexuality. And then staying in open communication with parents and the child. Okay. Schoolhouse. So if you end up being a school nurse, these are some things that you might do as a nurse in a school environment. So you're going to work on health appraisal. So you're going to do, a quick little physical exam and figure out, okay, is this kiddo sick or can they stay? And then, notifying parents. You're also going to be doing education. So you might be doing sex education with these kids. You might be educating staff about a topic. You might be educating parents about a topic. Okay. Controlling communicable diseases. So this goes along with assessing kind of the child and their potential infectious period. Counseling the parent and the child, okay, and then following up and potentially referring. So if you find a kiddo that's really struggling with schoolwork, talking with the parent about maybe following up with their primary care provider or getting some sort of early intervention in place for that kiddo. Injury prevention, still the most common reason for severe injury and death in school-age children is motor vehicle accidents, whether they're the pedestrian or a passenger in a vehicle. Okay, they need to be in the rear seats until age 13 and a booster seat until 8 years of age at least. A lot of them go higher. And then you just have to figure out what the age range and the height and weight range on your booster seats are. That's what's most recommended. Okay. ATVs are not recommended, or four-wheelers are not recommended under the age of 16. If they are using four-wheelers, they should have a helmet. Okay. Helmets with bikes. Now there's been a lot more injuries with electric bikes and electric scooters. So, making sure to talk with parents and children about that as well. Trampoline is also a big risk for injury, usually from ages 5 to 14, because you get multiple kids on there and they are trying to jump each other as high as they can. Okay. And trampolines aren't recommended for children of any age, according to the American Academy of Pediatrics. Okay. So parents, they should start to adjust to that child's increasing independence. So giving that child more independence. That way they can start to master these tasks by themselves. And then providing support that's not obtrusive. So you're allowing them to kind of cause and effect, try things and see how it goes instead of you as the parent interrupting in that to make that scenario go a certain way. Okay. They're starting to move from family relationships to other world relationships. School age disorders with behavioral components. So school age group, this is where you start to notice ADHD. So there's two forms of ADHD specifically. So there's the inattentive type. So this is a kiddo that has a really hard time staying on task. They're just kind of space cadet, but they're usually pretty quiet and just kind of sit there. They just get very easily distracted. Okay. Then there's the hyperactive type. This is kind of the usual type I feel that people think of for ADHD. They're all over the place. They can't focus. They're interrupting. They're talking out of turn. They have really hard time with impulse control. Okay. And then there's the combined type. So they can have kind of a form of both types of ADHD. Okay. So ADHD, attention deficit hyperactivity disorder. It used to be called ADHD/ADD, but now it's just ADHD. Okay. So if parents feel that their child has ADHD, they need to work with the nurse, the school teacher, their provider to develop a plan of care. Usually these kids will need to be on some sort of medication to be successful. Okay. Okay, enuresis. So accidents, urinary accidents. So sometimes there's a primary cause, which is usually there's something physically going on that's causing that, or there's a secondary issue that's causing the enuresis. So some kids, I feel like, more specifically ADHD kids, they have a really hard time stopping what they're doing to go to the bathroom. So they might wait until the very last second, and then that's where you see these kids have enuresis potentially. Okay. Your job as a nurse is to do a really thorough assessment and of their history from their parents. So kind of what started the problem, when did it start, when do they see it happen, and then a physical assessment. Okay. Talking with treatment for enuresis. So behavioral modification is probably the most beneficial for these kids. So a behavioral modification tool is a bedwetting alarm. So essentially what happens is you insert an alarm, like a little pad that goes into their underwear while they're sleeping. And then it's connected to an alarm, like a long wire with an alarm machine. And what happens is if that kiddo starts having, like going to the bathroom, then the alarm starts going off to try to wake them up, to get them to wake up and be able to go to bed or to the bathroom, in the bathroom. Okay. So that's the most successful way to combat enuresis if there's no physical reason why it's happening. Okay. Sometimes medications are used, like ditropan is one that's utilized. These don't necessarily fix the issue, but they can help kids to not have so many accidents. So if kids are going to stay the night at a friend's house, this is something parents can give them before they go. So hopefully they don't have a urinary accident. Okay. There's different alternative medications or complementary medications that can also be utilized, but usually the best approach is that bedwetting alarm. Okay. Being really supportive to the kids and to the parents and staying in open communication is really important. Okay. It's pretty embarrassing for kids to talk about their enuresis. So, allowing them to know that, they're not the only ones who experience that. Okay, encapresis. So this is stool accidents, usually involuntary, okay, but sometimes there might be something going on that's causing them to have the passage or leakage of stool, okay? Usually this happens because they're really impacted and super constipated, okay? So they get so constipated that the only thing that can get around their constipated stool is liquid stool. So what happens is that liquid stool then starts to kind of come through the anus and gets on their underwear. Okay. You want to make sure that there's not a structural cause, so like colon or something that's causing them to not notice when they have the sensation to have a bowel movement. Okay. Sometimes dietary modifications like removing dairy from the diet can be helpful in reducing the constipation. Behavioral modification, so getting that kiddo to stop what they're doing to go and have a bowel movement as soon as they feel that they need to have a bowel movement. Some kids have a really hard time going poop places other than their own home. So talking with them about if they have the urge to go to have a bowel movement somewhere out in public, that they need to go and do that Otherwise, they're more likely to have problems with encopresis. Okay. Okay. Child has an avulsed or a knocked out tooth. The parents are reluctant to try to reimplant the tooth. Where should the tooth be placed during transport for the dentist? Excuse me.
Cold milk.
Cold milk.
Cold milk. Yep, we all kind of talked about that already, didn't we? Okay, do you guys want to do this separate Kahoot for school age kids, or do you want to just keep going and do the Kahoot at the end for both school age and adolescents?
Can we try doing the Kahoot?
Yeah, we sure
Just kind
can.
of break it up.
Yeah, that's
Say last time we didn't get to do.
yep. We did it the other way last time. So let's do it this way this time. Try the interim. And then we can go back to the PowerPoint after. Yeah, I know we're all having issues with internet and stuff. So just try to rejoin as often as you can if it keeps kicking you out. Mackenzie, if you can turn your camera on, please.
I've been trying.
Okay.
Leave and join back.
Yeah, log out and try and come back in. Okay. Sorry, guys, I thought I had the two separate ones pulled up, so let me get them pulled up here now. And I'll share these just like I did last week with the two separate Kahoots too. Kahoot worked earlier while I did the review, so hopefully we shouldn't have any problems with it. Is everyone cold today? Is it cold where you all live? Colder than it has been at least? Okay, I'm gonna get this started and then I'll share my screen. Okay. Can you all see that now? Okay. Okay, we'll go ahead and get started. So this is just school age questions. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning does what? Well, preschool isn't school age, is it? Yes, they understand the actions of their consequences as either good or bad, and they have consequences. Okay. But in which of Erickson's stages do children begin to understand conservation? This should be not Erickson. This should be Piaget. Professor that shared these with me must have missed that one. Yes, concrete operations for Piaget. Okay. Piaget is your cognitive theorist. Okay. Good. Okay. According to Erickson, industry versus inferiority begins at age what? What's the age range? Six to 12. So your school age group is your industry versus inferiority for Erickson. And he's your psychosocial theorist. Good. Okay, multiple select. Erickson, industry versus inferiority. What's the goal? And it was a multiple select. Okay, so school age group, age range, right? They're developing their competence because they're learning to master tasks. Okay. And then this also promotes confidence in their own ability, and then they take pleasure when they're able to accomplish something. Okay. Good. Which is a common sign of stress in the school age child? Yep, stomach pains. You'll also see kids say like, my head hurts, or, something that you can't really prove whether or not they're really sick. But they'll start to have consistent complaints like that. Like, my head hurts, my tummy hurts. And usually then as a parent or as a provider or nurse, you can kind of try to figure out what's going on, that they don't want to go to school. Are they being bullied or something like that? Okay. Multiple select. What are signs of stress in school age children that need to be investigated? Yep. Behavioral regression. So they're regressing back. They were really doing well at potty training, and now all of a sudden they're starting to have urinary accidents, or they were doing really well with their schoolwork, and now all of a sudden they're struggling with their schoolwork. Bedwetting, stool accidents. Okay. So all of that should be investigated. If they start having bedwetting and they hadn't had bedwetting, what potentially could you be concerned about? Like, what
Type
could
1
be
diabetes.
Yeah, potentially. What else? What
Seizures.
about, yeah, what about like sexual abuse? right?
Yeah.
Behavioral regressions and urinary accidents. That would be a concern potentially for sexual abuse. Definitely. Okay. Good. Okay, multiple select. Safety education for the school-age child might include what? All of those. Motor vehicle safety, remember, what's the leading cause of death in this age group? Motor vehicle accidents, right? Whether they're in the vehicle or they're a pedestrian or a kiddo who's riding their bike and gets hit. Okay. Water safety, they're still not all great swimmers in school age group. So drowning still pretty high up there for a cause of injury or death. Firearm safety, that's a huge one. Okay. And then bicycle safety as well. Okay, good. Dental care typically begins around what age? One year. Okay. That's when they should have their first dental appointment. Parents are brushing their teeth really well. Okay. 1 year. Good. According to Erickson, trust is to blank as identity is to blank. This is also not another school age one. So yeah, Erickson is trust versus mistrust for infancy, right? And then identity versus what for adolescence?
Inferiority.
Inferiority.
Role confusion for adolescents. Think about adolescents. So that's like teenagers. They're trying to figure out what group they're going to fit in with, what they're going to look like, how they're going to present themselves to the world. And if they're not able to figure out how they fit in with their identity, then they're going to have some confusion. Okay. So that's adolescence. You were thinking of the school age group, which is industry versus inferiority. Yep. So you were very much on track with what this question should be pertaining to, but this question was still in regards to adolescence. Good. Okay, how does the onset of pubertal growth spurt compare in girls and boys? Yes, earlier in girls than it is in boys. Okay, good. What age-appropriate activities should you include in the teaching for a 6-year-old child? Jumping rope. I would venture to say playing hopscotch would be okay. But littler kids can do that too, like preschool age kids. You can see them, they should be hopping on one foot. At like age 4, they should be able to do that. 3, 4. Okay, some jumping rope. Good. How is chickenpox spread? Airborne precautions. Okay, chickenpox is really, really, really contagious. Now, most people have had chickenpox vaccines, so it's not as contagious as it used to be. But for kids that can't have the chickenpox vaccine yet or haven't had 2 doses, it's really, really contagious. So airborne precautions. So you need a 95 mask or a PAPR or a capper. And it kind of depends on where you work, what they have. And then these kids need to be in a negative pressure room if your hospital has one of those. Okay. Okay, multiple select. At what point is a child with chickenpox considered not contagious? There's a multiple select. Okay, no fever for 24 hours. That's across the board for any sort of illness. Kids should not be going to school if they have a fever. Okay. No new eruptions. So with chickenpox, it kind of starts in stages. So you'll start to notice the like red, itchy, burny kind of bumps on the trunk usually, so usually on the chest. And then it starts to spread and you'll see that the rash is in kind of varying stages. So one area that originally started, then we'll start to crust over, and then you'll notice a collection of another kind of blistery rash that's happening kind of periodically. So you have to wait for all of those lesions to also crust over before they're considered not infectious any longer. Sometimes that can take a week or 2 even. Okay. Which age group characteristically plays with the same-sex peers? Six to 12 years of age, so school age kids. Okay, good. Culturally competent care includes what? Yep, good. Incorporating that patient's cultural beliefs into the plan of care. And if you're not sure what they want incorporated, just ask them. Okay. True or false? Flossing daily is recommended for good dental health. True. Yep, good. Remember, what age can kids start to floss themselves? Remember the age range?
5 to 7.
5 to 7, yep. And before that, parents can help them. Okay. Good. 6-year-old needs to get a chest x-ray. What is the best explanation? Think about the kiddo's age. Yep, good. Technician will use a large camera to take a picture to look inside. Good. Okay. Care for a knocked out tooth, or a volst is the other word for it. Yep. So milk, saline under your own tongue. Okay. Good. Which thought process involves logically thinking for school age child based on the developmental theorist? So cognitive theory. Concrete operations, which is, who's your cognitive theorist? Which one is that? What's their name? Piaget. You guys are quiet today? No? Okay. Okay, multiple select. Erikson school age. It's a select all that apply. So what is included in Erikson's for school age kids? Yeah, all of those things. Okay. So industry versus inferiority is your stage for school age groups. Erikson stage, okay? They feel industrious if they're through the development of skill and their knowledge, okay? They feel a sense of accomplishment when they're able to accomplish that task and work with other kids or compete with others, okay? They should be challenged with tasks that need to be accomplished. They should be taught that not everyone will master a task or every skill, okay? And then rewarding them based on their mastery of skills or tasks, okay? And that can create them feeling inferior if they're not able to accomplish that, and then they're not able to get that reward, okay? Questions on Erikson's for school age kids? No? Okay. According to Kohlberg's conventional morality, school age children believe what? Following the rules is the right thing to do. Okay. So conventional morality, school age kids are rule followers. Okay. Good. Anorexia nervosa. Now this is also an adolescent thing. Yep, so an eating disorder where they're maintaining a starvation diet. Okay. Which signs may indicate that someone is struggling with bulimia? Once again, adolescent question. All of the above for that one. So sore throat that won't go away, teeth decay, or sensitivities, and then frequent trips to the bathroom when they're done eating. Good. Which of the following could be a sign of potential child abuse or neglect? Yep, unexplained injuries or bruising. Good. Cooperative play. What's cooperative play? Good. Kids working together in order to reach a common goal. Okay, so cooperative play, you're going to see that more in school age kids versus the younger kiddos. What type of play is considered cooperative play? Yes, good. Playing checkers or any sort of game. Good. Okay, what two common signs or symptoms can be found in children with ADHD? Yep. Interrupting and lack of focus. Okay, so what would some of you guys picked? Lack of eye contact and flat monotone voice. What would that probably be symptoms of?
Autism.
Yes, good. Good. All right. We'll stop the share screen on that one. Go back to the PowerPoint. That seemed like it kind of helped break things up a little bit more. instead of
Yes, ma'am.
Me just sitting and talking at you guys. Okay. Go back here. Go back to the slideshow. Okay. bear with me here. I'm gonna have to click all the way through. I'm assuming you guys want to do, get out a little bit early instead of continuing until. 10.
Yes, ma'am.
Okay, perfect. That sounds good to me. So we'll stay until 4:20 for your guys's full time frame. Okay, 4:20 Eastern, or some of you that are in Central Time, 3:20. Okay. All right. Next, we'll talk about adolescence. So adolescent child, that's the transition between childhood and adulthood. So there's a lot of physical changes, cognitive, social, and emotional maturation that occurs during this time period. Okay. Usually defined by the start of secondary sex characteristics. Okay, so start of breast development, the start of testicular enlargement for boys. And then it ends with the end of body growth. Okay, so around 18 to 20 years. Okay, so primary sex characteristics are the external and internal organs that are necessary for reproduction. Okay, secondary sex characteristics result from hormonal changes. So that would be like the changes in voice, hair growth, breast enlargement, increases in fat deposit, so like in abdominal fat. And then they do not, so secondary sex characteristics do not play a direct role in reproduction. Okay. Let me see, sorry, some chats. Okay, so boys, their first pubescent change is testicular enlargement. Okay. Then what will happen is you'll notice thinning and reddening of the scrotum and increased looseness. This usually happens between 9.5 to 14 years. That's kind of the average. Okay. Girls, first pubescent change are breast buds. Okay. At the start, after menses has started, it's not uncommon for girls to have irregular menstrual periods. Okay. Usually that can last about 2 years after they've started their cycle and be normal. If irregular menstrual cycles are lasting longer than 2 years after they've first started their period, then they need to see a provider to figure out why that's happening. Okay. There's a large height and weight increase. Okay. And then through puberty, a lot of moodiness and just hormonal changes that can cause moodiness in adolescent girls. Okay. After the start of breast buds, menstruation or their first period should occur within 2 years. If it's not starting within 2 years of them starting to have breast bud development, then there's something going on that they have delayed puberty. Okay. Girls and boys at age 11/12, by age 12, should have HPV vaccines. Says 3-dose series. It is now a 2-dose series if it started before the age of 15. If it started at 15 or later, then it's 3 doses. Okay. Okay, so here's your Tanner staging. So this is for female development. Okay. And then this is for male development. So for females, you look at breast development and their pubic hair. For males, you look at their testicular and their genitalia development and their pubic hair. Okay. Good. Okay. Sexual maturation is also accompanied by a dramatic increase in their height. Okay. So usually 20 to 25% of their total height is achieved during puberty. Okay. The growth period usually starts and should occur, I guess I should say, should occur within 2 years to 3 years of their puberty beginning. Okay. So if a female has had her period for 3 years, she's probably not going to grow much taller. Same with a male. If he's had testicular enlargement and that started greater than 3 years ago, then he's probably not going to gain much for height either. Obesity is associated with earlier onset of menarche in females. And obesity doesn't seem to affect the males as much with their puberty. There are voice changes in both sexes. I mean, you think probably more of, adolescent boys kind of getting the vocal kind of squeaks. But there are voice changes that happen in both male and female. Okay. Their goal for Erikson, your psychosocial developmental theorist, is sense of identity. So identity versus role confusion. So early adolescence, you're going to see more of a group identity. Okay. So kind of where they're going to fit in, what group they're going to fit into. And if they're not fitting into that group, then they're going to feel alienated or isolated. Okay. And then as you kind of progress through later adolescence, they're going to start to form their own personal identity. And then if they don't kind of form that personal identity, then they're going to have role diffusion or role confusion. Same thing, okay? Role diffusion and role confusion are the same thing. So they're not going to be sure where they fit. Okay. Sex role identity. So this goes along with body image. If they don't like their body image, this can cause depression, can also cause them to kind of question their sexuality and their sexual identity. Okay. Also, if they're questioning their body image and they're having a hard time in the category of role diffusion or role confusion, they're going to be more likely to have problems with their emotions. Okay. And obviously, any warning sign of suicide should be very much taken seriously. This could be sleep disruption, irritability, change in appetite, social withdrawal, or talking often about death or kind of seeming obsessed with death or suicide. So if any of those things happen, then, you could let parents know to be on kind of high alert for that. Okay. Their goal is to develop independently from their parent. Okay. So this is where there gets to be a lot of clashing with parents. Okay. Because they're trying to figure out who they are, what they're going to do separate from their parent. Okay. They want to be accepted by peers. If they're not accepted by peers, or they're not really sociable, then they're going to have intense loneliness. And then body image is a part of the development as well. Roles change for parents from protection to dependency to kind of mutual affection and equality. So this is an important part of the transition for adolescents, to allow them to kind of be seen more as an equal instead of inferior to you as a parent. So talking with parents about that. This process can become tumultuous and cause kind of a lot of clashing because they're kind of pushing the buttons, and it's hard as a parent to figure out what you're going to allow your adolescent to do for themselves. Okay. Major conflicts over independence and control of their responsibilities in their relationship with their parents. That usually starts between 15 to 17. Okay. So you as a nurse might suggest that the parents sit down with their child and work on setting limits and structure in their routine together, instead of parents just telling them how it is. Okay. Peers start to assume a more important role in the adolescent's life versus parents. Parents' opinions are still very much valued by the adolescents, but not as valuous as they were previously in previous stages of development. Okay. When they figure out their peer group, they feel a sense of belonging and power and strength. But if they're not really fitting in with a peer group, then they're having a lot of isolation usually. Okay. Transitioning from, parent kind of involvement to more peer involvement, that improves their autonomy. Okay. Friendships, usually personal friends are more common to be with same sex throughout adolescent, but of course, friendship is kind of progressing more towards intimate relationships in adolescence. Okay. It's really important for you as a nurse to build rapport with your adolescent patients. It's really important to have open, honest communication, allow them to have kind of open-ended questions and provide them with honest answers, letting them know, that you want to abide by their personal preferences, and any gender kind of questioning things, making sure you're affirming that. There are questions during puberty in regards to that. And then, parents, they may not want their parents in the room for a part of the exam. So asking them to step out is going to allow that child to have more open and honest questions and conversation with you as the nurse. Okay. Okay. Vaccines, like we talked about, HPV vaccine. So this is to prevent cervical cancers and precancers in girls and boys. Now it's recommended to do, and it's 2 doses if it's started before age 15 and 3 doses if started 15 or after. We usually start this at about 11 or 12 years of age. Okay. Nutrition, they're a lot more active. They might be driving themselves around, so they're going to be eating on the go more often. So a lot more fast food, quick gas station foods, things that they can grab and make really quick. So usually not the most healthy foods. So there can be a major fluctuation in body weight because of just their eating habits and being more snacky on the go. Okay. So if there's a huge fluctuation in height or weight, you need to be talking about their eating habits. Okay. It's helpful for them to keep a 24-hour diary of all the foods that they've eaten during the day. Sleep and rest. Adolescents are going through huge growth spurts and they require more sleep. Now, adolescent sleep is usually more of a struggle because they're having more homework, they're more involved in sports and other social activities. So sleep is not necessarily their focus area, but it should be. Okay. Making sure that they're getting good exercise and taking care of their dental health. Okay. Sex education and guidance on sex education in the adolescent age group. Some of these kids are on social media for like 7 or more hours a day. So they'll get a lot of their education or what they think is education through social media influences. So making sure that you're talking with these kids about, safe sex practices. So that way they're not just getting their information from, the internet. So people that they can talk to, parents, school nurses, they can go to Planned Parenthood, they can talk to you as their nurse in their clinic or in the hospital, they can talk to their provider. And those are all good places to start for education. Okay. Parents who limit screen time, their kids are less likely to engage in early sex practices. Okay. Safety and injury prevention and promotion of safety. So kids in adolescent age groups are more likely to be driving the vehicle themselves. okay, or driving the four-wheeler or, farm equipment, what have you. So their musculature development isn't totally complete yet. So they have slower reaction times. So more likely to have motor vehicle accidents, whether they're causing them or, they're just not paying attention to others on the road. Firearms are a huge struggle in this age group, whether it's, they're being utilized for hunting or they're for protection in the home, talking with the adolescents and the parents about making sure that their firearms are locked up and not accessible to their adolescents. Okay, sports injuries, they're more involved in sports, they're getting more competitive. So sports injuries, as their muscles develop, are not unlikely. Okay, so injury prevention for sports injuries, making sure that they're stretching. If they do have an injury, they're not going back to their activity, too soon without good rehabilitation. Or like concussion, post-concussion protocols, doing all of those, and then starting back up with their sports activity. Okay, Matt's 14. He seems to always be eating, although his weight is appropriate for his height. What's the best explanation for this? You guys can just unmute. Or if you're scared to unmute, you can also chat. Yes, A.
A.
Yep, good. It's normal because they're increasing in body mass during adolescence. Good. Okay. Let's see here. I'm going to stop sharing. Okay, let's go to adolescents. Okay, sorry, it's taking a while here. Okay, I should see that. Okay, all right, we'll go ahead and get started here. Adolescents. Okay, Erickson's identity versus role confusion. What's the age group? adolescents. For identity versus role confusion is adolescents. Okay. Good. You should be able to hopefully log back in if it'll let you into the Kahoot. Just go in your web browser and do kahoot.it and then enter the game pin. Okay. This is when adolescents need to establish their own identity to form values to live by. Yeah. Stage 5, identity versus role confusion, which is which theorist?
It was Erickson.
Is it Erickson?
Yes, Erickson. Good. Identity versus role confusion stage for adolescents. What's the goal? Yes, searching for a sense of self and personal identity. Good. What age do you have to be to drive an ATV? $16. Okay. So 16 or older, and they should have a helmet as well. Okay. All right. Since surviving a sexual assault, she startles easily, feels numb emotionally, and has flashbacks. Her symptoms resemble what? Yes, post-traumatic stress disorder. Okay. Any questions about that one? No? Okay. Many victims experience emotional and blank reactions from rape or sexual assault. Yes, emotional and psychological reactions. Okay. Some might even have some physical reactions. Okay. Which of the following is false about the HPV vaccination series? Sorry, I'm trying to read all these answers. An additional dose is needed only if 5 months between shots. Okay, so based on your book, it's 3 injections. Okay. Because our book is kind of outdated and it takes a while for schools and nursing programs to get kind of with the changing evidence. Okay. So technically, the false statement is vaccines consist of 2 to 3 injections. Okay. But like I said, if adolescents are less than 15, then they only get 2. If they're 15 or older, they get 3. Okay. The intervals between the injections, if they get 2, is 6 months. And then if they get their vaccine early, so they say they need that 6-month interval and they get it at 5 months, they will have to have an extra dose. Okay. With vaccines and intervals, if they're outside of that interval, usually what's recommended by the CDC is to revaccinate. Okay. Good. At what age should the parent expect to have major conflicts over independence and control with their children? (15 to 17). Good. What Tanner stage marks the onset of puberty in most males? So stage 2. So testicular and scrotal enlargement. Scrotal skin changes, it changes in texture, and then the scrotum starts to redden. Okay. So stage 2 is the onset of puberty. Stage 1 is, early childhood, typical appearance. Okay. Stage 2 is the onset of puberty, typically. What marks the onset of puberty in girls? Yep, menarche. So them starting their menstrual cycle. What else could be a sign of an onset of pubertal development?
Breast buds.
Breast buds. Yep, good. Okay. What is the Tanner stage or Tanner scale used for? Yeah, measuring puberty and sexual maturation. Good. Major causes of death and injury in adolescents are usually what? Automobiles. Okay. So across the board, automobiles. Okay. Good. True or false? Sex education for adolescents aims to provide information to adolescents about the issues related to sex. Yep, good. True. Good. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? Yes, have the parents leave the room. Okay. Direct questions, usually they'll just say yes or no. But it won't necessarily give you the information that you need as a nurse. Or they'll just kind of say the answer that they think that you want them to say. So make sure you're doing open-ended questions so they can say more than just yes or no. Okay. True or false? Keeping a food diary is the first step in the treatment for an an obese child. Yes, true. Good. Okay, multiple select. An adolescent has been brought to the ER with drug overdose. What are the initial questions to ask? Yep. When did you take the drugs? What type of drugs did you take? How did you take the drug? Like the route. Okay. And also how many can be helpful too. Good. All right. So there is that. Okay. So do we want to do week 2 cahoots? Do we want to do week 1 cahoots? Do you want to do the whole week 3 combined cahoots? What do you think you want to do? Since we're done early, since we didn't have time to take our quiz today, let me make sure that Canvas isn't back up and running. It's still not. So
I think a review of either 1 or 2 would be good.
Okay,
Whatever's gonna be on the exam.
it's all on the exam. Weeks 1, 2, and 3 are on the exam. So week 1, remember, was more of kind of generalized developmental theorist and developmental milestones. And then last week was infant, toddler, preschool. What do people feel less confident on?
Me personally, week 2.
Week 2? Are you guys good with doing that?
That's fine.
Okay. Perfect.
Question, so we just went over week 3 cahoots. Okay, I'll just be sure.
Yep, that was all week 3 stuff that we just did. Okay. So let's go to week 2. Do you want to do it all together? Like combination of infant, toddler, preschool? Or do you want infants, toddlers, preschool separate? Which do you think?
Combination. It's not
Okay.
gonna be separate on the
All
test.
together.
Okay, perfect. Sounds good to me. We'll get this going. Like I said, I will put those separate cahoots on the announcements too as soon as I can when Canvas is back up. I will put my review that I did this morning under the exam 1 reviews announcement. Okay, so I'll post everyone's recordings there. It's better if you can attend live it's more beneficial for you. Okay. So the schedule is on there. I know right now you can't see Canvas, but trying to attend one of those live would be best. Otherwise, the recordings will be there.
Do
Okay.
you have information on when Canvas might be back up?
I have no idea. They're trying to figure it out. We should all get an email to your Fortis email when it's back up. Okay. So say it's not back up by Wednesday, obviously your guys is, you know, whatever you, I don't think we have discussion posts this week. No, that's next week, but, you know, you won't be able to look at what all is due. So hopefully you've written it separate. But like as far as the NCLEX questions and stuff, it's going to be hard for you guys to get in there without going through Canvas. So once Canvas is up, I will put those announcements up so it should alert you. And that could be another way that you guys are aware that Canvas is working again. Okay. But we should all get emails that it's working to your Fortis email. But yeah, they haven't given us any sort of time. It's an Amazon web service that is having issues. So just Canvas utilizes that through Fortis. So that's why it's not working. Okay. Go ahead and get started. This is week 2. So it's infant, toddler, preschool was week 2. Okay. Alrighty, there you go. There's the pin to go ahead and join. And remember, full credit for participation will be until 3:20 Central Time or 4:20 Eastern Time. Okay, we'll go ahead and get started. Okay, week 2, infant, toddler, preschool. Okay, multiple select. Types of play considered to be sensory pleasure play. Yep, playing in the sand, finger painting, playing with mashed potatoes. Yep, good. Anything involving the senses is sensory pleasure play. The nurse notices white patches in the mouth of an infant that cannot be removed with the tongue blade. What is your intervention? Yes, good. What would those white patches be?
Thrush.
Thrush.
Thrush. What do we do for thrush?
Nystatin.
Yeah.
Yep, good. Okay, what type of play is considered to be cooperative play? Yes. Good, playing checkers. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning blank. Mackenzie, the code for the Kahoot is down here at the bottom, 2411487. And it should let you join when we get to the next question. Okay, so pre-conventional preschoolers, they understand accident or actions are either good or bad and they have consequences or rewards. Okay. Good. What nursing action is appropriate to teach preschool age child about a scheduled procedure? What would be the best way to teach them? Yes, using a doll to explain the procedure. Play, okay? Play is one of the best ways to teach these kids what's going to happen. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? Okay, so utilizing play can be helpful, but usually that's more helpful in the preschool age kiddo. Minimal physical contact is going to be what's most beneficial for toddlers, okay? So getting down on their level, talking to them, okay, before you touch them or interact with them, okay? Good. What should you suspect if you note that an infant's chin is quivering, fists are clenched, and they're inconsolable? Pain. Yep. An infant is having pain. Good. Multiple select. Erickson describes infants as trust versus mistrust. What does trust mean? Remember, it was multiple select. Good. Yes, the infant feels more secure. The infant can predict what is coming and that their needs will be met. And the infant is usually a calmer, happier child. Okay. They shouldn't have to cry a long time to get someone's attention. That usually progresses towards mistrust. Good. 3-year-old child is having an outpatient procedure. How would you help the child to be less fearful? Yes, use a doll and let them see what you're going to do. Good. Multiple select. You need to do an assessment on an infant. You walk into the room and the infant is asleep in the mother's arm. What are you going to do? Listen to their heart sounds and assess their respiratory status, right? Because that's the most quiet that kiddo is going to get, is in their mother's arm while they're asleep. Okay. Okay, when do you switch from formula or breast milk to whole milk? (4:41), somebody just asked about normal time class ends. 4:41 is when class is supposed to end, but because we don't take any breaks, we can get out 20 minutes early because you guys have 2 10-minute breaks potentially for it being over a 2-hour class. It's kind of a weird end time, but that's the end time because of holidays and stuff. Okay, when teaching about car seats for newborn infant, what should you tell parents? Yes, so gently used car seat that's less than a year old from a friend, as long as it hasn't been in an accident. Okay, that can be used. New car seats received from family, those are good. And then they should be rear facing in the back seat. Why couldn't you use the car seat from 10-year-old sister?
They expire after a certain time.
Yeah. So expiration usually is 7 to 10 years on car seats. So if you had a 10-year-old sibling, it's probably expired. Good. Okay, another multiple select. When and how do you introduce solid foods to an infant? Yes, introduce foods starting at 6 months. Wait 4 to 7 days before adding another new food. Okay, introduce one food at a time. Good. Before assessing a 4-year-old child, what techniques would you use to approach this child? So think of preschool age kids. Yes. Tell the child that you like their Batman shirt and that he's your favorite. So identify something about that kiddo that you can kind of connect on. Okay. Good. Of course, telling them what you're going to do is important, but sometimes you're going to be poking them or getting their blood. And if you tell them that right off the bat, it's not going to go well for you guys. So try to identify something that you can connect with them on. Good. What technique can be used to examine a toddler? Yeah, so toddlers, it's easier usually to use play to assess their different body parts. Now, listening to heart and lungs first, that's going to be what you want to do in infants, because as soon as you start to, move infants around or unwrap them really well, then they're going to start being fussy. So, and the longer they're fussy, the harder it's going to be for you to listen to their heart and lungs. So start with heart and lungs first on infants. Toddlers, usually you can get them to kind of play with you to let them let you assess them and that not really affect their vitals and things like it does on infants. When assessing a healthy child's lymph nodes, what should you expect? Yeah, you shouldn't be able to feel them. They should be non-palpable. Good. If you feel lymph nodes on an exam, what is that usually showing?
Is it strep?
Could be strep. What is strep? An infection, right? Yep, so some sort of infection is going on or some sort of immune response is going on. So it could be infection, it could be something like cancer if it's multiple lymph node sites. Good. Which Erickson stage of developmental levels would be used for a toddler? This picture gives me some anxiety, but this is definitely toddler aged development. Autonomy versus shame and doubt. Also in this picture, doesn't it look like she's drinking a coffee? But it's really a bottle, and she's way too old to have a bottle. Okay, what pain scale would you use on a 3.5-year-old child? Faces. Remember, at 3, you can start using the faces scale. Less than 3, they need to be using the FLAC. Okay, good. Multiple select. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? Good. Toddlers can do things by themselves. Shame is when parents do not allow them to try new things and allowing the infant to try new things. Should say toddler. Okay. Toddlers cannot usually play all by themselves. They can't keep themselves entertained that long, usually. But allowing them to do tasks for themselves is really important. Good. 2-year-old boy is playing in the mud and dirt. What type of play is this? Sensory pleasure play. Good. Parent of an 18-month-old boy says he says no to everything and has rapid mood swings. What would you tell that parent? Yep, good. That's a normal behavior for that age child. What if that's still happening at 6? What would you do if the parent tells you that that's still happening and they're 6 years of age?
Is that like regression?
Yep, it could be a regression. So it's telling you that something's going on, that they're having a hard time, right? So they need some Early intervention. Good. Yes, behavioral consult. Good. What is descriptive of the preschooler's understanding of time? So, yes, they associate time with events. So you can tell preschoolers, okay, after you go to bed and you wake up, it will be morning time. Or after we have supper, then you go to bed and it's bedtime. So kind of identifying what's going to happen, and that kind of allows them to understand time period. An infant is crying and shaking their head. Which feature of pain is this infant showing? Location of pain. Okay. Crying, shaking their head. Usually that's telling you that there's something hurting them with their head. Okay. Location. One-month-old infant's back of their head is flat. What would you tell the mother? Tummy time. Yep, have them do tummy time. What is going on with this kiddo? If the back of their head's flat, what is it called? Plagiocephaly. Good. Or brachiocephaly. Good. Very specific. That's good. Newborn mother has type O positive blood. Her infant has B positive blood. The infant is highest risk for what? So they're at increased risk for jaundice, hyperbilirubemia. And that's because their blood types aren't compatible, right? So mom's blood type is O positive, baby's blood type's B positive. Okay, so that puts them at increased risk for high bilirubin or jaundice. So those babies might need to go on Billy blankets or Billy lights. Which intervention may decrease the incidence of physiological jaundice in a healthy term infant? Okay, so a little infant, their temperature control isn't going to be that great. It used to be recommended to place them by a window for sunlight exposure. You worry first off about their temperature regulation, but also their risk of getting a sunburn. Okay, so actually what's more recommended to decrease the risk of jaundice is feeding them early and frequently. Okay, if babies are having physiological jaundice, they're eating, they're peeing, they're pooping, that's how they're going to get rid of their bilirubin levels, is by peeing and pooping it out. So if they are doing all of those things and they're still having high Billy, then they need to get a Billy blanket or phototherapy with Billy lights. Okay. Which intervention lowers the risk of sudden infant death syndrome or SIDS? Placing the infant in a supine position for sleeping. Remember, infants are at higher risk for SIDS if their parents or someone in the home smokes, okay? If they're co-sleeping or if they're too hot, okay? Those are just some of the potential risk factors, okay? So what you can do to improve that is having them sleep in their own bed. Infants crawl before they walk. This pattern of growth is called what? Sequential trends. Good. How do you communicate with parents that do not speak the language that you know? Yes, use the telephone interpreters provided by the hospital. Good. Don't use somebody that came with them to translate. Don't use somebody at the hospital who's not a translator to translate. Okay. What age would most children be able to understand under, on top of, beside, and in back of, or behind? Four years of age. Okay. By 4, they should be able to understand under, on top of, beside, behind. Okay, good. In terms of language and cognitive development, a 4-year-old child would be expected to what? Follow simple commands. Good. No abstract thinking until adolescence. Okay. They don't really think about other people other than themselves. They're kind of self-centered. And they don't understand conservation yet in preschool age. That's school age. What pain scale would you use to assess the pain of a toddler? Black. Toddlers, remember what age? 1 to 3. Okay. So if they're less than 3, you need to use the black. Okay. Good. Multiple select. What safety instructions would you teach the parents of a 6-month-old child? Good. Rear facing in their car seat, covering electrical outlets because at any point they could start crawling, right? At 6 months. Usually later, but it can start at 6 months, and then not laying the infant on the changing table because without a safety harness because of the risk of rolling off. Good. Nurse receives a phone call from a mother about her 6-week-old baby. He's crying a lot every day. What can she do? Yep, have them come to the office for more information because what could be going on with this infant? What are some things? Colic, yep. What else?
Could be irritated from formula.
Yeah, acid reflux, right? GERD,
Digestion issue.
yeah. Yeah, good. Good. Multiple select. What should an infant be able to do at 9 months? Yep, hold themselves up on their feet, roll completely over, voluntarily hold a rattle. They should be sitting independently by 9 months. Okay, if they're sitting only with support at 9 months, then they need earlier intervention, probably physical therapy or something. Okay, another multiple select. What are the cognitive characteristics of a 2 to 7-year-old child in the pre-operational phase? Unable to understand others' points of view, imaginative, and then using objects to represent something else. So using a broom, but saying it's a horse. Good. No logical thinking yet in pre-operations. The first expected fine motor developmental milestone for an infant begins with what? Yes, the reflex palmar grasp first. That is baby's parents put their finger in baby's hand and it's a reflex. They grab their hand. Okay, or their finger, excuse me. Okay, that's a reflex at first and then it becomes voluntary. Okay, good. 2-year-old has difficulty in activities, sensory sensitivity, and only speaks one-word responses. Assess with what? What would you need to assess this child with? Yes, so the modified checklist for autism toddlers. So MCHAT. Because if they're having sensory sensitivities, they're only speaking one-word responses, and they're having difficulty with different activities, then those are all signs of potential autism. So doing that screener, the MCHAT, is helpful to assess whether or not they're high risk for autism. Okay, multiple select. Parents are concerned. Her 8-month-old child is not developing like their older child. What is normal for 8 months? Yes, sitting alone unsupportive and rolling over completely. Both ways. Good. Multiple select. The mother of a child is suspected of having Munchausen syndrome. What should be in the plan of care? Yep, the mother needs to be supervised when with the child and monitor all things brought into the room by the mother. Okay. Not having the mother be allowed to visit or having a CNA in the room at all times with the child won't necessarily prove or disprove that that parent has Munchausen's by proxy. Okay. What fine motor skill is expected of a 4-year-old child? Button a shirt. Okay. They should be buttoning a shirt. So why was the red one wrong? Because gross motor, right? Skipping, using alternate feet. Skipping is a gross motor skill, big muscle skill. Walking upstairs using alternate feet, same thing, gross motor. So tying shoelaces or buttoning a shirt is more of a fine motor activity. So buttoning a shirt is what 4-year-olds should be able to do. One more question and then we can be done. Multiple select. What gross motor skills should a 4-year-old be able to do? Walking upstairs using both feet, hopping on 1 or 2 feet. Okay. Jumping rope is a little early at 4. Okay, good. Alrighty. Any questions, comments, concerns? No? Okay. Make sure you guys are looking at all of the